Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Joe DeVivo. He's the CEO of Intouch, which was just acquired by Teladoc. Holy cow, is everybody talking about this? So congratulations.
Thank you. I'm so excited. So excited. Just to join an awesome team. It's just a great time for us.
Yeah, well, you're going to have to tell me a little bit more about this acquisition than that. So $600 million, it's huge. This is a much deal in two ways. I think it's a huge deal for virtual care. Mm-hmm. It's a huge deal for digital health, both, right? So talk to me about virtual care, though, because I'm hearing from a couple other telehealth CEOs that I've been talking to. This is a seminal moment, the fact that Teladoc acquired your company. Do you feel that way?
Very much so. I mean, we've focused on helping patients inside the four walls of the hospital. It's interesting because our journey for telehealth started in the hospitals. Teladoc started with direct-to-consumer engagement, and we're meeting in the middle.
Yep.
And we have the same strategy, the same desire to be a part of every step of the journey, and now we can actually realize that. So we're very excited.
And if larger comments on how this impacts digital health. I mean, if you feel like where the market is at right now, it's like we saw some IPOs last year. We're talking, I keep hearing gossip about more IPOs this year, lots of other mergers and acquisitions. So, I mean, how do you feel like this deal kind of fits into that? Has digital health hit its moment as well, you think?
I think so. Healthcare is very inefficient. It's very difficult to access care. It's very difficult to do so cost effectively.
Yeah.
And one of the driving missions has been, well, how do we make it easier for the consumer? We've seen so much of a digital revolution in how we book our flights online, how we bank, and that is now going to happen for healthcare. How we enter the health system, how we engage with a physician, how we manage our data, how we take more accountability for our health. So there's so many different ways to drive the inefficiencies out, and this is probably one of the biggest deals that you have the largest direct-to-consumer company, the largest in-facility hospital company coming together to make sure that we could be a part of that digital journey for all the patients.
This is really incredible. I mean, this is like a continuity of care play, which is really remarkable. And so, I mean, talk about your hopes for the patient experience and all of this.
Well, one of the things our founder, Dr. Yulin Wang, always focused on was how do you provide high-quality care where the patient is? In places around the world, there is the ratio between the number of doctors available to the number of patients that need care is staggeringly disadvantageous. So we have this valuable resource in doctors. So we want to bring them to where the patients are. If someone has an urgent care issue, and if there's not a specialist there, we can bring that specialist. We can link the facilities and help improve quality. So it's an amazing, amazing solution.
Let's flip this and talk about from the provider side. I mean, what's beautiful about this is you've got like the outside of the hospital, the inside of the hospital, and then the back outside of the hospital. So, I mean, do you think we're going to start seeing health systems really look at the way their workflows even are created in order to incorporate virtual into the mix in a way that actually helps improve efficiency and reduce costs and also provide that seamless experience? Do you think the workflows are going to start being impacted?
I think for every clinical specialty, that workflow will have a digital component, a virtual component, and then an in-person component. If you're not being imaged, diagnosed, cut open, every other instance actually is just an engagement. And that engagement, instead of having to go in to schedule an appointment or go in just to be seen how you're doing or go in after an operation, how's the incision, how are you walking, literally whether it's cardiology, orthopedics, nephrology, neurology, there's going to be a component in every single step of their clinical care where a certain component of digital is going to be a part of it. And literally the all starts with Teladoc.
It all starts there. It's all going to continue on there, right? So I want to ask from your perspective, I mean, so you're going to stay on and be involved moving forward. And so what's next for you in terms of scaling up the in-hospital side of the business?
Well, I think one of the most exciting parts of this is Teladoc is the undisputed leader in the payer space, in the employer space, Intouch, legacy Intouch in the health system space. We now have the opportunity not only to service our existing constituents better, but we can actually start having conversations that bridge all three constituents. We can talk to a health system about what a particular payer and employer might need. We can do data analysis on some chronic care patients and say, hey, it's better to be treated here, and maybe this is a new payment model, so that it's not just about putting these things together to be together. It's about having additional level of longitude services that might really totally change healthcare.
I want to talk about this for a second because, I mean, patient outcomes so important. I don't want to minimize that at all. But I am a former health plan employee, and so I'm always interested in talking about the payment model and potential changes to how we're paying for care. And so being able to bring all these different stakeholders that you listed together, through this service, which is different and creates new opportunities for the way care is covered. How do you think that that your acquisition is going to play a role in kind of redefining the way that healthcare is paid for?
Well, there's typically tension between those three constituents.
Yeah, absolutely.
And there's different things that drive behaviors. And by having a company that has excellence at every single level, we're going to find ways where we get rid of some of those tensions and we come up with solutions. And by having expertise, it's going to have a single organization with a foot in each of those constituencies to be able to find those solutions. And that's that's ultimately, I've been in healthcare 30 years. I've enjoyed just a marvelous career of bringing technology to market. But to see and be a part of a solution that can actually bend the cost curve, improve care, and allow some of this unnecessary tension to potentially flow together, it might be aspirational, but that's what I'm really hoping.
Well, Joe, congratulations. I mean, after 30 years, this is fantastic. Good for you. All of the best in your new role in Teladoc.
Yep.
Congratulations
Thank
again
you.
on the acquisition. Great work.
All right, appreciate
Thanks for
it.
stopping by.
Thank you.
I'm Jessica DaMassa with WTF Health. Thanks for joining us.